lot of people in the Hardwick area with breathing problems. We've obviously got a history of mining, a proud history of mining, and there are a lot of people who smoke, unfortunately. And the combination of that has really meant that Hardwick particularly has more than double the amount of people with breathing problems and with chronic obstructive pulmonary disease than other places in the country.
My family are a brass banding family, and of course the instruments were always around. So I was a very curious child. At about the age of 3, I decided that I'd like to play, and until 3 years ago I was still playing. The biggest shock of my life was being diagnosed with COPD. I really didn't know I got anything wrong with my lungs. All right, you know, if I've got a cold, I've got a cough. It just never entered my head because of the actual usage of my lungs.
Going back about 5 years now, I had an exacerbation, and I was so bad I couldn't get to the doctors. We had to go round and get my next door neighbour to bring his car. I couldn't drive or anything like that. I was so bad. Took me to the doctors and just sort of started the tests and went from there, and I was diagnosed with COPD.
We feel that it's really important that people can look after themselves. It's one of those conditions that really you can look after yourself. And the problem has been that we've not really had sufficient rehabilitation opportunities for people, and we haven't really helped people to look after themselves. So the combination of pulmonary rehab, which obviously helps people to get back on their feet once they've got problems, and Breathe Easy groups, which helps people to connect with other people with that problem and really to help themselves, we feel really central to what we're trying to do in Hardwick.
Patients are often really sceptical when they're referred, because the thing that makes them breathless is exerting themselves, and the one thing we're going to ask them to do is to exercise. So you really need to gain the confidence and the trust and try and persuade them that it's going to be a really useful treatment for them. A comment we once had from a patient's wife was that we'd given her a husband back, and he was now able to do things that he couldn't do before.
I had no self-confidence. I couldn't walk. I think I walked 8 metres without being really, really breathless. And when I completed last week, I think I did 200 something metres. That's with having a rest, of course, because it's when I move that I become breathless. So I have to stop and get my breath back. But yeah, it's been brilliant. And I've enjoyed it. It's been a laugh as well. And I'm back, you know, in myself, I'm back to how I was.
I see Breathe Easy as being the next logical step after pulmonary rehab. Once you finish pulmonary rehab, as I said, the effects are about 6 months. What Breathe Easy aims to do is to take that time period and extend that as long as possible by keeping people involved, bringing people together, like-minded people that have got this condition but want to manage it themselves. So the social side to me is 50-50 with the knowledge part.
The whole idea of Breathe Easy is around self-management, providing support and information to people living with a lung condition and their family members and carers. It's an opportunity to get the information to help you stay well, help you self-manage your condition, meet other people, and just get the information that you need to help stay well, really.
If you want to take control of what your condition's doing and decide that the condition's not going to control you, you're going to control it. It's about taking the actions. The actions are join something that's going to give you exercise, going to give you knowledge so you know how better to manage your condition.
It's training, it's education, it's priceless. So I'd say just do it. Get up, get moving and do it.